Okay, good morning, good evening, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss some important writing tips.
What's up, our friend?
So, if you can share this session with other doctors, nurses, and pharmacists, that would be great. So, what we will do in this class today, first, we will discuss case notes. These case notes are written by myself. So, first, we will discuss case notes, then we will discuss the model answer, and I will mark your letters also. Okay. So just if you can share this session with other doctor, nurses, and pharmacists, okay, that would be great. Okay. If you can do that, if you can't do, then don't worry. Okay. Okay, just let me share the session and then we can start. If you can also share, that would be great. Okay. So if you have written your letters, you should have sent me the letters before the class starts, because I keep your letters in order. So the first person who sends me the letter is on the top, letter number 1, to get the correction. Okay, free correction. Okay, so to send me the letter for feedback, you should send me in Microsoft Word file the typed letter so that I can mark your letters. Okay. So can you see the case notes on my screen, please?
Yes, sir.
Okay. Thank you. Okay, just let me open the session. Okay. Okay, let us start. Okay. Please, you should send the letter before the class starts, because I cannot now copy the letters and then I can't reply you. I cannot teach you at the same time. I can't do all the things at a time. Okay. I'm the only one person who does all of these things, so I can't do all of these things at a time. Please be careful. Okay. So these are the case notes. Can anybody tell me which type of letter this is? This is urgent letter, referral letter, urgent referral, normal referral, discharge letter.
Urgent
Which
letter.
urgent letter?
Referral letter.
Urgent referral letter. Okay. Okay, good. Is to a medical professional, non-medical professional?
Medical.
Medical professional. Okay, good. So have you written this letter in chronological order, order of importance?
Order of importance.
Order of importance. Can you please explain? Maybe some people are new with us. So what is order of importance?
Actually, order of importance is we initiate with today's visit, then continue other relevant information.
So in order of importance, we write today's visit first, the most important visit.
Yeah.
The most important visit. It could be on today's visit, it could be any other visit, but the most important visit first, and then write the other visits, but depending upon the situation. Not in every letter not in every urgent letter we write order of importance. It depends. Okay. So first, once you get these case notes in your real exam, what you will do? What you will do once you get these case notes? Can anybody tell me what you will do once you get these case notes?
Within first 5 minutes, we just check is an urgent letter or referral letter or
Yeah.
discharge letter, and we must be addressed. It is to whom we write, like doctor, therapist, or any other.
Yeah. Okay, very good. So we need to read the case notes quickly, and we need to see the task. What is the task? What is the plan? And read the case notes quickly. Okay. So let us do this. Your doctor, nurse in this clinic, and read the case notes, complete the task. Then where we should go? We should go to the task. Okay. In the task, it says there is using the information in the case notes. Write a letter to Dr. Che for further investigations and treatment. Okay. And this is Dr. Che, Emergency Registrar, Manchester Hospital, 30 Brown Street, Manchester. Okay. And this is my WhatsApp number. Okay. They don't give WhatsApp number in the real exam. Okay. This is just for advertisement. Okay. Okay. So what you can imagine from this, still I don't know what is the diagnosis, because these case notes I have written a long time ago, at the end of last year. So what you can imagine from the writing task, what kind of this letter is, and to whom you are writing. Maybe looks like maybe you are GP, maybe looks like you are GP, and you are sending this patient to a specialist for further investigations and treatment. Okay. And that doctor is in the emergency department. Is that clear or not? Okay. Okay. So then we should go, before you read the details, you can see the diagnosis or plan or assessment. So what is the diagnosis here in this patient?
Diabetic ketoacidosis.
So the diagnosis is diabetic ketoacidosis. Very good. Okay. So after that, where we should go? After that, where we should go? Where we should go after that? Go at the start. Okay. So these things are very easy. You don't need to spend a lot of time. This is name, gender, address, date of birth, age, social background. Just quickly. Okay. She married, no children, lives with husband, is at a 3-year-old, 23-year-old. Okay. Other family member live interstate, and she works as a waitress in a bar. And past history, no smoking, drinks 2 glasses of wine per day. Weight is this, BMI is this, no allergy, no surgeries. She has a history of type 1 diabetes since 2015. No exercise. Family history, older sister, type 1 diabetes, mother hypertension, and special note, patient has learning disability. Okay. Can anybody tell me, can we just imagine what is important, what is not important so far in the case notes? What we should include, what we should not include, or what is important, what is not important? Can we do that? Can we do that?
Yes, sir.
I think so far no, because as we don't know that complete diagnosis, the complete case notes, so it's a little bit difficult. You can just imagine, but a little bit difficult. Okay. So we need to read the complete case notes, then we can decide what is relevant, what is not relevant. Okay. So before we go into details of visits, what we should do? What we should do? Before we go into details of each visit, what we should do? Can anybody tell me quickly, please? What we should do?
We need to look for admission condition.
No, we need to
Recently
see
he
the
has
just dates.
Go
Just
through
see
the
the
date.
dates.
Date.
Okay. Just see the dates. Okay.
Mm.
Only one that says, yeah, that's only your plan. They carry me, come drop for house. All of them, come go find. That's how you know they do. I'm not even come for house.
Okay. So I just received one letter in the
Oh,
Zoom chat. Okay. So please mute. Okay. Mute, please. Who is this?
They prepare it.
Please, this is not good. Okay. Please mute. Okay. Okay. So then we need to see the dates. Okay. The first date is 11th of August 2022. Next date is 25th of October 2022, mean after almost 2 months. And then we have 8th of November 2022. Then we have last date is 19th of November 2022. Okay. Then let us go to the read the case notes. Okay. On this date, that was in August 2020, on 11th, patient came with runny nose, fever, soreness in throat, mild headache on bending forward, malaise and tenderness, and upper respiratory tract infection was suspected. We have prescribed augmented BD for 5 days, and patient's condition improved after completion of it. Please mute, please. What is this, Rafiq? Please. Please mute, okay? It is very disturbing when we are talking, okay? So this was the treatment that was given at that time, okay, in August. Then this patient comes in October, 25th of October. Patient was brought to GP clinic by her husband. Patient was unconscious, sweating, with shaky hands, and further questioning revealed that patient today forgets to break fast after insulin, okay? After taking the insulin, patient forgot to take the breakfast or eat breakfast. So these were the vitals, and this is the GCS scale 10 by 15, and BSR, okay, or you can see RBS or BSR was 60, okay. Random blood sugar was 60. This was the treatment that was given, and we advised the patient to do this and that, and don't skip the meal and review after 2 weeks. Then patient comes after 2 weeks, and these are the tests that we have advised here. These are the reports. Everything is normal here. HbA1c is 15%. It shows poor control of sugar levels, and then lipid profile is deranged. Okay, lipid profile is high. Okay, cholesterol is high. So these are the vitals at that time, and this is what we have advised the patient. We have started the patient on insulin. Just we have done some changes in insulin, and we have started the patient on atorvastatin also, and advised to do this and that. Okay. Then this is today's visit. Today's visit. This is discharge day. Today's visit. The patient comes with tiredness, means a patient is having tiredness. Please, you know you cannot send letters because I have to concentrate on the class. Okay. So patient has a tiredness, has vomited 3 times in the last 24 hours. He has nausea, abdominal pain, increased urination, polyuria, fruity smell in breath. Okay. Patient is thirsty, indicating dehydration, confused. Patient not comply with current insulin regime, forgets to take. And this is the examination, and there is dehydration also. These are the investigations, almost similar. Just urine dipstick is done, and urine dipstick shows ketones. HbA1c is 14%, and random blood sugar is high now, 400. Okay. So your diagnosis is diabetic ketoacidosis. and you plan to refer this patient to the emergency department. You have given, what you have given to this patient is IV fluids, insulin, and 15 units and with potassium. Okay, this is the emergency treatment that you have given to this patient. Now my question is this a real emergency patient or just like normal emergency urgent letter? What do you think? This is a real emergency patient, okay?
So it's a high emergency case
Yes.
because it's have a low blood sugar.
Yeah. No, here is high blood sugar is diabetic
high blood sugar.
ketoacidosis. Is ketoacidosis.
Yeah,
Okay, but it's still ketoacidosis is emergency, okay? So it's real emergency. So what do you think in this letter we should follow chronological order of importance?
Order of importance.
Order of importance. So maybe some of you are new today. So just let me tell you what is order of importance. So when you write a letter, so first you write the purpose, okay? After purpose, we write, please mute. If you are not talking with me, please mute, okay? It becomes very, Navjot Kaur, please. This is not good, okay? Please. I can easily remove those people who make noise. I can easily remove them from the class, but it would not be good, okay? So please mute, okay? So if there is background noise, it disturbs the class, okay? Okay. So even I forgot what I was talking about. So order of importance. After purpose, so in this letter, we need to write the most important visit, that is today's visit. If you start writing any previous visit, so the reader will say, okay, what you are talking about? This patient is dying of ketoacidosis and you are talking about low blood sugar that he had and this and that. So why we need to write today's visit first after purpose? Anybody can tell the reason why?
so because we have to understand first of all its past history. After that, we can diagnose his present history also.
No, that is not the case. Here, after purpose, you need to write today's visit first, then write previous visits.
This is because emergency.
Is emergency. People just try to you try to understand what is the purpose of this OET and writing letters. Actually, this is emergency patient, and doctors and nurses are too busy. Okay, these professionals are too busy. This is background noise. Okay, doctors and nurses are too busy. And if they have, why we need to write a letter of 200 words, 180 words? Why we cannot write a letter of 500 words? Why? To get B grade? This is one of the purpose, okay? But what is the main thing to teach us that we should write a concise letter? What they want us to teach, okay?
Don't lose the main purpose.
Yes, they want us to just write to the point things that your colleagues. Your voice is breaking. So they want to teach us that your time and your colleagues' time is very important, very precious. They cannot spend a lot of time on reading a letter of 500 words. So you just need to write the important things, to the point things, concise things, just so that they can understand the patient's situation. Okay. Very good. Okay. So now let us decide what we should write in this letter and what we don't write, because we know the case. Okay. It's diabetic ketoacidosis. In the social background, what we should. Yes, please.
So with this giving profile of the patient, how can we understand what the basically they wants?
What they want means the reader.
Yes, sir.
So reader want from you that how should I treat this patient? What is the problem of this patient? Okay, they just need this.
Okay.
So we will understand these things with passage of time. Maybe you are new. Okay. So in the social background, if you are writing this letter, what we should include, what we should not include. Married, we should write with no children, when lives with husband is important to mention or not?
Not important.
Not important. This is not important. This patient is having diabetic ketoacidosis. If she lives with a husband or if she lives with mother or father or whatever, there would be no changes in the management. Okay, no need of this. Okay. Other family member live interstate means other states. Is it important?
No.
No.
Okay. She's a waitress in a bar. Is it important?
So I think it is important.
Okay. For this letter, it's not important, okay, because this is emergency letter. They are not talking. They are not going to quit his drinking habit, okay. So if it is
So
about this child
maybe,
letter, or maybe, okay, let us keep it optional, okay. You can write, you can skip, okay. It is optional, okay. Let's go to next, okay. Past history, smoking. We don't need to write smoking
No,
because
it is
this
included.
negative things we can skip. Negative things we can skip in OET, okay. Drinking again, we can write, we can skip, okay. Let us consider as optional, okay. Okay. BMI is also optional. Allergies, surgeries, no need. Okay. Diabetes history is very important. We will mention this. Okay. What about this family history and mother has hypertension? Family history of type 1 diabetes is important or not?
No.
it's
Not
important.
relevant. Not
Not
relevant.
important.
This is
So important because क्या कहते हैं, diabetic is a genetic disease.
This is important for diagnosis, sir. It is already diagnosed.
Already diagnosed. Very good. Who is this? Who told me this?
Suman, sir.
Okay. Very good. Okay. This patient is already diagnosed. Just imagine if this patient got unconscious and you don't know if this patient has diabetes or not, and her blood sugar level is 400, and you don't know if this patient has diabetes or not, then you are sending this patient to a specialist. Then family history is very, very important because the case is not diagnosed. Here the case is diagnosed. Why family history is important? Nothing, okay, not important.
Not
Okay.
relevant.
Not relevant. Okay, hypertension, mother takes Remipril. Is it important?
No. No.
Is it important? No, no. Sorry, your voice is breaking. Sorry, your voice is breaking. Okay, okay, okay. So if this patient is having type 1 diabetes but is not emergency, there is no ketoacidosis. Okay, and the patient is moving to another place to live with his daughter or with father or mother, whatever, to live with somebody else. And you are writing this letter to another GP. Okay. In that case, is it important to mention mother's history of hypertension?
No need.
Yes, we need it.
We need
I'm
it
just saying,
because
yeah, we need it.
there are fluids which are given in a patient with diabetes, so you need to
There's
know.
no problem with fluids. There's no problem with fluids. Okay. Actually, no, just try to understand. Here, this patient is emergency, diabetic ketoacidosis, and you are sending this patient to the emergency department. Okay. Here, no need to mention about hypertension in this. No, this patient who has type 1 diabetes that is not controlled but not have ketoacidosis, just uncontrolled blood sugar levels. You are writing to another GP.
Online.
Please, how I can teach like this? Okay, if you keep talking on the background.
He's German. Oh, this is a medical doctor.
I think, sir, can you just remove them because disturbing everyone?
Maybe
Yes.
maybe I don't allow anyone to participate. So this is what I can do. So nobody can participate now. Just I will keep talking. Okay. So who wants to participate? Just tell me. I will unmute you. Okay, from here, because I have muted all of you. So who wants to participate? Just write me in the chat. I will raise the hand. I will unmute you. Okay. That will become very boring. I will just keep talking. Okay. So if the same patient is you are sending to another GP who will take care of this patient for a long time. So GP is a doctor who takes the care of patient for a long time, maybe rest of his life till his death. Okay. So this patient might develop hypertension anytime in his life. So that is why family history of hypertension is very important when you are writing this letter to another GP. Okay. So these are just background information. Okay. Okay. So for me, it is not okay. It's just people can participate. Does not look very good. Okay. So what about this visit? Can anybody tell me? Patient came in August with runny nose, fever, throat soreness, mild headache, and tiredness. Upper respiratory infection was suspected. Question mark means suspected. Okay, and we have given augmented. What do you think about this visit? Okay.
It is not relevant.
Anybody
need
who
to
has
include this.
okay, just let me tell you one thing. It's very easy for the examiner to mark the letters. If anybody writes this letter, so if it is doctor, your score is C plus. If you are a nurse, your score is C. Okay, clearly, because you don't know what is relevant, what is irrelevant. Okay, so why the examiner is including this visit at the start? Can anybody tell me why? Why?
To
Can anybody
understand
tell
the
me
Trap
why?
level of
us.
Yeah, why?
To trap the
Yes,
students.
Just as a,
indicates
yeah, this is a trap. Okay. Yeah, so if you people are well prepared for the exam, you know this is irrelevant visit. If you include irrelevant visit, then you will definitely fail. Okay, so very important. Okay, see the situation. Okay, if the same patient is diagnosed with lung cancer after 2 weeks, try to listen. Okay, if the same patient, this one, he comes on 11th of August with these symptoms. On, let us say, on 25th of August 2022, you diagnose the patient with suspected lung cancer. Okay, then you refer this patient to pulmonologist. In that case, is it important to mention this visit or not?
We
Yes.
should mention
Yes.
to him.
It can be mentioned because
Is
she was already
important. Even it is respiratory infection, but still, as you know, some lung cancers, they don't appear at the start, and sometimes they just keep appearing with respiratory infections until we suspect lung cancer. Okay, or maybe symptoms of respiratory infection last for more than 15 days, and then we consider something like TB or something, cancer or like that. Okay, so then it is important, but in this letter it is not important. Okay. Okay, so then, so one visit has gone, and in the social history, past medical history, almost nothing is important. Just one or two things. Just he has a history of diabetes, type 1 diabetes since childhood, and rest of the things, maybe drinking. Okay, so all of these things are not important. Then we have only 3 visits. The patient came on 25th of October. Then patient came on this date. If you see here, this little bit relevance, these 2 visits are related with each other. Patient comes here with a hypoglycemic, event, and then we have given we have advised some tests. Okay, and then we have changed the medication according to those tests. Okay, so it's very important to keep in mind this. Then we have today's visit, that is the most important visit. Okay, so in our letter, in our referral letter, the most important are these 3 visits. Okay, and out of these 3 visits, what is the most important visit?
Today visit.
Yes, this visit, that is of today. Okay, when patient is coming with diabetic ketoacidosis. Okay, so now we need to plan to write a letter. Okay, this is what you should do in the first 5 minutes, or in first a few minutes, so that you can plan. Okay, so this is my planning. I will write purpose. As it is an urgent letter, I will write today's visit. Then I will write initial visit. Okay, so here initial will be a second visit. Okay, then I will write second last visit. Okay, then if there is any important history, past medical history, if it is something important, or maybe I can adjust it at the end of conclusion or somewhere else, and then I will write the conclusion. Okay, this is my planning. Okay, any questions so far? Any questions so far?
No, sir.
Okay, very good. Okay, so then if you are in the real exam, just make a plan like this quickly. Don't spend a lot of time. Okay, this just as teaching class, that is why it takes a little bit time. But in the real exam, you need to decide these things quickly. Okay, what is important, what is not important, how you will organize, which type of this letter is. So decide this quickly. Okay. Yes, thank you, Mr. Simon Javed. Okay, so here, so we will write purpose, and we will follow this order. Okay, so let us try to write the purpose. Okay, what we include in purpose, 2 important things, just quickly. Thank you, Ramesh Khalid. What we write 2 things in the purpose. Always keep in mind that if you are a doctor or if you are a nurse, and the purpose has 3 marks. Okay, 3 marks. You should get 2 out of 3 or 3 out of 3 to get B grade. Okay, in case of nurses, C plus. Okay, so if you get 1 out of 3 in purpose, even if your rest of the letter is perfect, okay, 100% perfect, still you will not get B grade, because purpose is very important in OET. If your letter is perfect, but your purpose is 1 out of 3, you will not get B grade. Okay, because purpose is very important. Okay, so what we need to write in purpose, 2 important things. Can anybody just remind me?
To whom
Anybody
we are
remind?
writing. To whom
What has happened?
Type of letter.
Type of letter? No, we don't need to write type of letter in the purpose.
What has happened with the
What
patient?
do we want from the
Diagnose.
reader, and what is the problem with the patient?
Okay, very good. Okay, but your name tells there you are Dell. Okay, not Toshiba, not the thing. So you should write your own name. Okay, so very good. Thank you. Okay, so we need to write 2 things. Number 1 is what is wrong with the patient. Okay, what does this mean? What is wrong with the patient? Can anybody can tell in other words?
Diagnose.
Mainly diagnosis. Most of the times diagnosis. Okay, and what we want from the reader is just treatment or something that we want from the reader. Okay, most of the cases treatment or assessment or like this. Okay, so let us write purpose for this letter. I am writing to refer, so we should go here. Mostly in the real exam they will write in the bracket, they will write miss, MRS or MS. Okay, so you can use that language, okay, as a title, okay. The real exam, they will make it clear here. Is MRS base or MS base, okay. So we will use MRS base, okay. Base, and then we need to use the second name, that is surname, Miss Stark, okay. Then what we should write?
The diagnosis.
Diagnosis. Okay. Who is suffering
Suffering from DK.
DKA, okay. But in purpose, it would look better to write, okay. To complete, okay. Diabetic
Ketoacidosis.
ketoacidosis, okay. What do we want from the reader? It is written here, investigation and treatment.
Yes. Investigation and further management.
Further investigations and treatment will be
appreciated.
Appreciated, okay. Very good, okay. So Dr. Vasif says, I am writing to refer Ms. Stark, whose features are suggestive of. Actually, Dr. Vasif, here the diagnosis not means not with question mark. This is the confirmed diagnosis. So we don't need to write suggestive of. We can use consistent with, okay. So you can watch my video, types of letters, types of OET letters on my YouTube channel, and which I explain how to write purpose for each type of letter, okay. So this is rough purpose that I have written. It needs improvement. Can anybody tell me where I can improve? Just talk with me, okay, please. You can search by my name, DrChe, plus name of your exam. Just search and it will appear there on YouTube. DrChe plus name of your exam, okay? DrChe OET, okay. So can anybody improve this purpose? Just please participate actively. So one of you is saying is that it should be, instead of will be, it should be would be, okay? So
Yeah.
why, what is the reason?
Polite.
We need to be
Is polite language. Very good. It's very polite. As you know, doctors and nurses are very sensitive people. They need polite language. You cannot give orders. You can request them. Okay. So we should request. We should not order. Okay. So one thing. Any other thing that we can improve?
Be highly appreciated.
Okay, we can use highly appreciated. That is, mostly collocation, and it looks good. Highly appreciated. Okay. There's not a mistake, but it can be improved. Okay. Anything else? Sorry. Anything else? Okay, so Dr. Vasif is saying on Facebook, Dr. Vasif is saying that diabetic acidosis is wrong. Why it is wrong?
We need to write a small letter for D and K.
Why?
Because it is not from the person name.
Very good. Okay. If some disease name is given after someone's name, like Parkinson's disease, Alzheimer's disease, Down syndrome, in that case, we use capital word, but only with Down, only with Parkinson, only with Alzheimer. Disease and syndrome would be small, okay? But here, this is common names of diseases are written in small, okay? So it would be small, okay? Anything else?
I'm writing to urgently. We need to include urgently.
Okay. We need to write it urgently, okay? So where we can use urgently? So we can use here, I'm writing
to urgently refer.
Okay, another place?
Your urgent investigations
Your
and
urgent
treatment.
investigations and treatment. Okay, so these are two places where you can write. So we will prefer here. I want to
What
show the
about?
examiner.
Mhm.
Yes, please.
Yeah. Yeah. What about
Yes, both.
is suffering? Suffering. I think suffering is judgmental or something like that. I'm not sure.
So what we should use? Do you not want suffering from? So what we should do?
Who is diagnosed?
Who is
has been
diagnosed with?
diagnosed.
Who has been diagnosed? Okay.
Yes.
What else?
Who was diagnosed with?
But still we are in the process. It's not clear cut. Okay. So just we have, because we are adding for further investigation and need to think. Okay. So I would prefer here. Please avoid using suffer from in your OET letters. Okay. Avoid word suffer from in your OET letters. Okay.
In I think with temporary condition,
We should do
like
temporary, whose I will prefer like this. Whose features are consistent with. Okay.
consistent with,
Yeah. If it is suspected diagnosis, we will write whose features are suggestive of or whose signs and symptoms are suggestive of. But here is consistent because clear diagnosis. One more thing we can mention the purpose that this patient is type 1 diabetic patient. So we can mention a type 1 diabetic patient maybe here, or who has type 1 diabetes and diabetic ketoacidosis, something like that. But I would prefer like this. Okay. Anything else that we can improve here? So on Facebook, I can see only comments by Mr. Siman Javed and Dr. Swad Ahmad. So please, all of you try to participate actively, okay? Thank you. Age is not important. We can mention, we can skip. Profession, we can mention, we can skip, okay? So don't try, let us try to write today's visit, okay? So before we start writing today's visit, first we should plan quickly what we should include in today's visit, okay? This plan that is here, we have given IV fluids and insulin and potassium. Where we should write this? In today's visit or in separate paragraph, where we should write this?
Today's.
First, my question is, are we asking the reader to give this to the patient? And we have already given these things to the patient.
We
This is my
already
question.
given.
We already given,
given.
okay, as you're gonna first aid, as first aid, we have given these things, okay. So we will include this in today's visit. So in today's visit, we have tiredness, vomiting 3 times in the last 24 hours. We have nausea, abdominal pain, increased urination, polyuria. So why I am using increased urination and in the bracket polyuria? Why? Because these case notes are written by myself. Okay, I have written these case notes. So why I am using increased urination and bracket I am using polyuria?
Same meaning, I think.
So can anybody tell me why I am doing this? You will see this in the real in the case notes also in the real exam. Why I am doing this?
Like we are the medical person.
Can anybody give me exact answer, please?
Because you are writing to a professional, medical professional person.
It
Then what
means
should I
that
do?
her frequency of urination.
If you are writing to medical professional, then no need to write this
is
increase urination, only just polyuria.
Very good. Okay. If you are writing to a common man, layman, you will use the word increase urination. So if you are writing to a doctor or nurse, you will use polyuria. If you are writing to a doctor and you write increased urination, so should I cut your marks or should I give you good marks? I will cut your marks because you are not using appropriate language according to the reader. So your language in OET will change according to the reader. If the reader is layman, you will not use difficult terms like polyuria. You will use increased urination. Okay. So fruity smell and breath. Okay. Patient is thirsty, indicating dehydration, confusion. Patient not comply with current insulin regime, forgets to take. Okay. So you can see there are a lot of things very difficult to write in one sentence. Okay, and to organize these things. So almost all of these things are important. We cannot skip any of these things, but just can be a little bit concise. Okay, let us see examination. Saturation is okay. We don't need to mention. BP we can mention is low. Pulse we can mention. We can skip. Respiratory rate is also a little bit high. Temperature is normal. Okay. There is dehydration and GCS is 15 by 14 by 15 is very important to mention GCS also. And we have done all of these tests. I need to mention names of all of these tests? So I have done the full blood count, ABGs, urea electrolyte, random blood sugar, renal function test, liver function test, HbA1c, urine distillate. Do I need to mention names of all of these tests?
No.
This all
Just
blood
we can
blood
write all
tests.
the
Yeah.
only
So what you
abnormal.
will do? Only abnormal or positive things, okay? Only abnormal or positive things, okay?
Yes.
Okay. So, okay. So here the positive thing is pH, random blood sugar, and HbA1c is important, and urine dipstick is the most important is urine dipstick, ketone positive, okay, and sugar level, okay. And then I will write the treatment, okay, this treatment. It looks very easy, but when we start writing, it becomes very difficult, okay. Just one minute. Okay. So we will start with today, and then we need to write the most important symptoms, okay? Mist, stark, presented with, okay? Then we need to write the symptoms. Okay. Patient is not compliant with medication. We should not write in the first sentence. We can write later on. Dehydration. We can also write later on. So other symptoms we can write here. Okay. Presented with complaints of tiredness, vomiting. We don't need to go into details of vomiting, nausea, abdominal pain,
And
and
polyuria.
polyuria. Okay. So what I'm thinking, I want to join this fruity smell with dehydration and patient is not compliant with, okay, with these first statement. So how you write about fruity smell in breath? His breath had fruity smell and we can use also present tense, okay? And he was thirsty due to Dehydration we can mention later on in the examination, okay? We should mention somewhere he was not compliant with his medication. What about this thirsty? Thirsty we can write in the examination, and fruity smell we can include here, okay? Polyuria and fruity smell in breath. Even I can add non-compliance with as he was non-compliant to his medication. I have written this model answer for a long time ago, so I have not prepared this, memorize this to show you my knowledge of these things. I'm just writing naturally. So I have written model answer, but I can show you later on. But I have not seen this before class, just to show you my high level of English and this. In OET, you just need to make things easy and clear for the reader, okay? So almost we have covered all the things in the first part, okay? So dehydration we will cover in the examination. So then I will skip pulse. You can write respiratory rate. His blood pressure was 90/60.
Heart rate.
Heart rate we can skip, okay? Respiratory rate. Now we can use is or are, both are okay because this is today's visiting. 24.
Can mention on examination.
Yeah.
Right?
Yeah. On examination.
Then we'll write her blood pressure was like this, like this.
Yeah, yeah, okay. We can write on examination also. Then is what you saw, his blood pressure is this. We can read is or was, okay. 24. GCS level was 14/15 and his mucous membranes were dry, okay. You can try like this, okay. So today Ms. Stark presented with complaints of tiredness, vomiting, nausea, abdominal pain, polyuria, and fruity smell in her breath. We need her, okay. As he or she, okay, is female. As she was non-compliant to her, okay. This is a common mistake that we make, okay. To her medication examination, her BP, so is a female, okay. We were this, this, and her mucous membranes. These mistakes you can pick even on proofread. Okay. Okay. So on examination, our blood pressure was this, respiratory was this, GSS was this, and mucous membranes were dry. Okay. Then let us see what else we need to. So we can write one sentence about investigations and one sentence about treatment, okay? So what we were for investigation? For investigations, her
Blood investigations.
blood investigations. Even blood investigation would not look good, okay? Because urine is not blood, okay? Or pathology, yeah, lab pathology reports
TV.
showed pH 5.5, RBS 400 milligram per deciliter. HbA 1C 14%, and ketones 3+, and ketones were positive. Ketones were positive on urine analysis. Okay, you can write this urine analysis, urine dipstick.
We can write
Urine
the
dipstick. You
we
can
can
urine
write,
dipstick or urine analysis. Okay.
sir, we can write the investigation were advised, which revealed. No.
First, we don't. When there is when the test results are given, then you don't need to first write these were ordered or were requested. Then they showed this. Okay, this is not needed. Okay. So their investigation report were this. Okay, then we need to write the treatment. Okay. He was given. He was administered.
He was commenced.
Commenced is also okay. He was administered. IV fluid. You can IV fluids like this. Okay, IV fluids. Trigger, lactate, 1000 ml. 15 units of
Insulin.
regular insulin and potassium.
Potassium.
Write like this, okay. So this is roughly what we need to write, okay, in today's visit, okay. I will show you now from model answer what I have written, okay. So these are almost 75 words. That is not bad because this is the most important visit. Okay.
So no need to write the dates and only write today.
For today, you don't need to write date, okay. Even in my model answer, I have written 74 words. Here, I have written 75 words. What is this? So here is 74 words and here 75 words, almost similar. So please be out, okay? Please be out. Abdullah, nursing instructor, please. And Bazpati, please. This is not good. Okay. So here today, this is from model answer. Today, Miss Stark presented with tiredness, nausea, vomiting, abdominal pain, confusion. Polyuria, confusion, GCS scale I have written as confusion. Okay. Polyuria and fruity smell in her breath due to non-compliance with our insulin regime. Okay. So what I have written here? Due to as she was non-compliant on medication and due to non-compliance with her insulin regime. This is the same thing in different words. Okay. Her examination revealed this a little bit better. Her examination revealed BP this, respiratory rate this, GCS score this, and dry mucous membrane. So here it is better because I'm not using separate verb for all of them. Here I'm using separate verb for all of them. Both are okay. Both are okay. So you can write in any of these ways, okay? Her investigations, you can only write investigations, okay? You don't need to write pathology or blood or this. Her investigation showed low pH of this. I mean, I'm using low, okay? Low pH of this, random blood sugar level of this, okay? And HbA1c 14, and her urine dipstick was positive for ketones, okay? Now her urine dipstick was positive for ketones, okay? She was given 1000 ml of ringer lactate, 15 units of regular insulin and potassium, okay? So then we have initial visit. I think you people can write initial visits, okay? That would not be too difficult. But as you know, 75 words here, and we have in purpose, how many words we have in purpose? 25 words here. So you have written already 100 words, okay? So how many words you have for the 2 past visits and the conclusion? Almost 100, okay? Almost 100 more words for conclusion and previous visits, okay? So you can write previous visits very concisely. Let me show you here. Initially on this date, Miss Stark was brought unconscious and had sweating and shaky hands as she forgot to break fast after injecting insulin, okay? So I'm going to remove this person, okay?
Yeah, better. Thank you, sir.
Okay. Okay, initially on this date, Miss Stark was brought. If we want to mention, she was brought by somebody else, okay? If it is presented, just use Miss Stark presented if she comes by herself, okay? So was brought as she was unconscious. So I'm just imagining, this is my imagination, as she was unconscious, she was brought by somebody else. That is why I'm using passive voice, okay? Miss Stark was brought. If it is presented, Miss Stark presented with, low mood and this and that, means she is coming herself, okay? So here is brought by somebody else, okay? Was brought unconscious and had sweating and shaky hands as she forgot to break fast after injecting insulin. Her vitals were unremarkable. So other vitals are normal, so I'm not writing them individually, just are unremarkable, except for GCS score of 10/15, and her random blood sugar level was 60. You can see here, I am writing investigations plus all the examination together in one sentence. You can see or not? So these are the examination, Glasgow Coma scale, and the investigations, okay? All of them together in one sentence very concisely, okay? She was treated with 100 ml of 20% glucose and some relevant investigations were ordered, okay? Just, we don't need to mention their names, okay? Because we will mention them in the next sentence, okay? 2 weeks later, her blood investigation showed HbA1c 15% and deranged lipid profile. Just deranged lipid profile is enough. You don't need to write into details, okay? Therefore, 100 units of this and that, okay? She was commenced on all of these medication. Then, in the conclusion, I would be grateful if you could further investigate and treat her condition accordingly. So this is from the past history. Only thing I written, she has had type 2 diabetes since 2015 and her current BMI is 30. So I'm not writing any separate paragraph for past history. These are the only 2 important things for me to mention for this patient, because this patient is a real emergency. You don't need to go into too much details about this patient, okay? So let us mark these 4 letters quickly. Miss Bhagia is there. Miss Bhagia, are you here on Facebook or on Zoom with me? Miss Bhagia. Okay, Dr. Kia, yeah, are you there, Miss Bhagia?
Yes, but it will be hard to talk because of the noise here.
No, this is yours letter? Dr. Bala, no, this person, Miss
No,
Bhagia.
no, I don't.
No. Okay, it's not you. Okay. And Dr. Kia, you have sent me letter on email. Maybe I've written your name a little bit wrong. Are you there?
Yes, yes, sir.
Okay. Okay, thank you. When is your exam?
John, 10th John.
Okay, you are a doctor, yes?
Yes.
Good. Okay, doctors, all of you, first, before we mark this letter, first we will count the words, okay? So 294 words. Without reading this letter, what should be the score? Please write in the chat, okay? Without reading this letter, just with number of words, 294 words, what should be the score, okay? What should be the score? For doctor, C plus is equal, because if you don't get B, so you are equal if you get C or C plus or something, okay? So I will mark your letter, Miss Bhagia, after this letter, okay? Because I was just announcing you were not there, okay? Okay, now we will go into details. So out of these visits, which one is, you can see this very long visit. So she is writing each and everything, okay? So I'm writing agility refer Miss Stark, very good. A 21-year-old woman who has been recently diagnosed with diabetic ketoacidosis. Very good, okay? You have written first part of your purpose, very good, okay? So but second part is missing, what you want from the reader. So what should be the score for this purpose? Maybe 1 out of 3. Because you have written one part, what is the problem of the patient. You forgot to mention what we want from the reader, okay? NC Mr. presented at the clinic on this date with signs and symptoms suggestive of upper respiratory infection. Therefore, she was prescribed augmentin for 5 days, okay? People, can you see this visit? All of you can see this visit. This is what I have explained before
Yes.
class, okay? Okay, so doctor, what should I call you? Okay, anyway, Chinese doctor, maybe like this. Oh, this name is, they also use name in which part? Okay, anyway, are you there, doctor? Dr. Kia, I should call you Kia,
Yes.
okay?
Yes.
So this is not to not to blame you, nothing else, okay? Many doctors are very good, but they don't know what is OET style, okay? Your English is good. English wise, you're not making a mistake, okay? Miss Star presented at a clinic on this date with signs and symptoms suggestive of this. Therefore, she has been prescribed. It should be past tense because it was in the past. She was prescribed this medication. As you know, this is not too much important visit, so you are trying to make it very concise, okay? Very concise. Just you are mentioning this, but still, this is irrelevant visit. We don't need to mention it, okay? Just delete it, okay? 2 months later, she was brought to the clinic by her husband with loss of consciousness, sweating, and shaky hands because she forgot to take breakfast after an insulin injection. Okay, good. Her vital sign was normal. So this is not single vital sign. It should be in plural. Okay, vital signs were normal. Okay, apart from GCS this and low sugar level. So you should write how much it was low. Okay. She overweight with BMI. BMI does not fit very well here in this visit. Okay. When you're talking about hypoglycemia and these things, okay? So she has also been advised. So we cannot use present tense. This is past visit. We cannot use present tense here, okay? It's wrong, okay? Regular exercise and regular meals, okay? For weight reduction, regular exercise. So as you have written one paragraph, then write a separate paragraph for next visit, okay? 2 weeks later, the blood results revealed hypercholesterolemia and poor control of blood sugar levels. There she was given intermediate
Hello.
acting
Hello, sir.
insulin 10. Yes, please.
We cannot see the screen.
You cannot see screen?
Yes.
All of you cannot see screen?
No, sir.
Yes.
Yes, sir.
Yes.
We can't see this letter.
Okay.
Yeah, the letter we cannot see. Yes.
Okay, let us try now. No?
Yes.
Yeah.
Now,
Yeah. Yes.
yes.
No.
Okay, thank you. Thank you for. Let me see here what is happening on Facebook. Okay. Okay, 2 weeks later, blood investigation revealed hypercholesterolemia and poor control of blood sugar level. So we should write how much it was poor blood sugar level control. Okay, just write the exact values. She has been, we cannot use present tense in past visit. This is a big mistake. She was given, okay? This, in addition to regular short acting insulin, 6 units 3 times per day. She has been, again, please don't use present tense in the past visit. That is wrong. Regular exercise for weight reduction and added, okay. And atrocity 20 milligram was added, okay, once a day. We need passive voice here, okay. Mr. returned today with nausea, vomiting, and abdominal pain. She didn't comply with the regular insulin regime. So you can see she is just writing very simple sentences. This is not good, okay? There was tachycardia, tachypnea, headache. This is also a very good way. Instead of writing respiratory rate and heart rate, tachycardia, tachypnea, dehydration, and confusion, blood tests showed metabolic acidosis. You can write also metabolic acidosis, high blood sugar level, and ketone positive on urine dipstick. Okay, very good. So is married, okay. So we don't need this such a long, okay, social history. So if you remove this paragraph and this paragraph from your letter and you remove these grammatical mistakes and you write today's visit first, then you can easily get B grade, okay, if you write the second part of the purpose also. Okay. So before we move further, just let me show you one thing. We have VAP hybrid writing course. In this course, you will write different types of letters. 14 letters, 3 referral letters, 3 urgent referral, 3 discharge letter. In 2 letters, there are letters to non-medical professional, 1 letter pediatric patient. In 1 letter, there are 2 patients. In 1 letter is GP to GP transfer. In case of nurses, is 1 community nurse to another community nurse letter. Okay. Mostly in the course we have these 14 letters, but mostly I keep helping my students till their exam with extra corrections without extra charges. Okay. Sometimes they send me 20 letters, sometimes they send me 30, 35 letters in total, and they keep getting feedback. Okay. So this is called VIP hybrid course. So slots are available if you want to join. And we also have speaking feedback, individual feedback. So you can get feedback on speaking also. So let us go for Miss Bhagia's letter. Just we will go quickly because I'm really tired. Okay. I'm ready to refer Miss Stark, a 21-year-old woman who has been treated for diabetic ketoacidosis. Do you think it is true? Do you think it is true who has been treated for?
No.
No.
Just we are given the first aid, okay? So this is not true, okay? Your further investigation and treatment would be highly appreciated. Initially on this trimester, so we need to write today's visit for this is the urgent letter. Please be careful, all of you, okay? Even you're not mentioning urgent in the purpose, okay? Initially on this trimester was brought to the clinic with unconsciousness, okay? With unconscious, no. As she was unconscious, maybe like this, as she was unconscious, sweating, had shaky hands. This is why I've written different, symptoms that are difficult to organize in one sentence. Okay, so you need to rearrange the wording. Okay, and she had not taken her breakfast after insulin. Her vitals were unremarkable, except for join them except for BMI of this. BMI is not vital. Okay, So just write here the GCS are, BRS, don't write, BMI here with vitals, okay? She was treated with intravenous glucose and was advised to exercise, reduce weight, and avoid skipping meals. Skip no. Avoid skipping meals with double P. After 2 weeks, Ms. Stark presented for a scheduled review with her pathology reports. Her HbA1c was this. Cholesterol was high. She was commenced. Okay, very good. Okay, you're making very concise. That is good. Today, she know we will use name of the patient at start of new letter. She presented with tiredness, vomiting, nausea, this and that. For she was confused. Because were dry. This is you're not joining. You're joining the sentence this with only comma. It is not okay. She was not compliant. Compliance, no, compliant with recommended insulin regime. Her bags, ABG showed a metabolic status. RBC was this, okay, this, okay. Diabetic acidosis was diagnosed, and diabetic acidosis are already mentioned in the purpose. You don't need to write here again, okay. She was given this, okay, emergency department. I would agree if you could initiate her further investigations. Treatment, we can change a little bit language in the conclusion. So word count is 196, but this letter I will give like, like borderline C plus, C or borderline C plus, okay, needs improvement. Lot of improvement. Simon Javed, you are on Facebook with us and you are nurse, but you are very intelligent nurse. Okay. So your greeting is okay. I am writing to refer urgently. No, urgently refer. Okay, change word order, please. Okay. Mr. A waitress who has been diagnosed with diabetic ketoacidosis and non-compliant to medication. Something is missing in and is non-compliant to medication, to her medication, maybe like this. Your further investigations would plural would look better and management would be highly appreciated. So this is a typing mistake. You should be capital here. Just typing mistake. Today, this is very good. Your written today is presented with. So this is wrong. Okay, we don't need passive voice here. Just presented only. Okay, yeah, are presents with, are presented with complaints of tiredness, vomiting, diarrhea, abdominal pain, and dehydration along with, okay, along with increased urination. You can see somebody will write this. Okay, you can see. Somebody will write this, okay? This is not increased urination, just write polyuria. You are writing to a doctor, okay? She is found confused, unable to remember compliance with a certain. She is not unable to remember. She is non-compliant to her medication, okay? You cannot say she does not remember as she has disability in learning, okay? One very important thing in this letter is you should mention learning disability for this patient is very important, okay? On exam, but not like this, okay? On examination, BP. Can anybody show me where is verb in this sentence? Verb. Any verb in this sentence?
No.
Can you show me any verb in this sentence? This is just like notes. As we take notes, BP this, respiratory this, okay, BP this, pulse this. So this is just notes. There is no verb. This is grammatically wrong sentence. There is no verb, okay? There is no structure of sentence. Therefore, blood investigation is advised. It should be plural, but investigations were advised would look better or are advised, which is consistent with information condition. No. We should not make it too general. Just write what the investigation showed, and then you don't need to write like this. Okay, just improve this part. Okay, on this date, she know at the start of new paragraph, we will use name of the patient where she was presented to the clinic. This is okay. We are presented because patient was unconscious. With low blood sugar. Even you can see people, this nurse is writing low blood sugar level even before symptoms. Then here she became unconscious. First we should write symptom, then write investigations, please. Okay, this is logical order. As that of she forgot to take breakfast after administering insulin. She became unconscious with GCS 10%. Wait, this, this. Again, this is language of case notes. Here, this does not fit very well in the sentence. Consequently, she was administered this and that. Okay. This further investigation. And in addition, she was advised to reduce weight, regular exercise regularly. Okay, this is grammatically wrong. Exercise regularly. Avoid to no. Avoid to skip no. Avoid skipping meals. We need ing form. Okay, and review back in 2 weeks. On subsequent blood investigation revealed blood sugar control and increased level of cholesterol and lipid profile. No need of any lipid profile, just make it concise. Okay. Medication regime was adjusted. We need passivize was adjusted. As we used to this, okay, and prescribed to, okay. In view of the above, your assessment management would be profoundly appreciated. Okay, you are close to C+. Just improve a little bit more to get C+, okay? Improve a little bit more to get C+, okay? So, sorry. The last letter that I had is someone called Liaquat as a nurse. Are you there? Male nurse? After that, I will take your questions, okay? If you have any question, you can ask me about writing. Nurse Liaquat is there on Facebook or on Zoom with us. Are you there? No? Are you there? You send me letter in the comments in the chat of Zoom. Nurse Liaquat Hussain, nurse. No? Not there. Okay, that's good. Okay. So anybody has any questions about writing, about this letter? Any other question about writing?
Sir, what about the title? If there is no title mentioned in the case notes, so in this case, what we will do? We will write still means Mrs.
Title
or
mean Mr. or Miss or like this?
yeah. If not mentioned in the case notes.
Mostly in real exam, they make it clear. They write in the bracket is Mr. or Miss or Mrs. They make it clear. You don't need to worry about this. Okay. Don't overthink. If it is not given, just write Miss or Mrs. Both are okay. If it's a male, it's very easy. Just write Mr. Okay. If it's a baby, a child, then we will only use first name. Okay. If, for example, this patient was 7-year-old patient, what you will use? Miss Stark, or you will use something else?
Master?
No need of master. It's old fashioned. Okay. If it is a baby, just use first name only, Angela. Okay. Angela. Is Joshua Vance use Joshua? Okay. And David Cameron will use David. Okay. Like this. Any other question?
Thank you.
So please, all of you, invite your friends, your other doctors, nurses, where you are working, or your friends to join free classes so that we can have more students. So if you want to join VIP hybrid course for writing, or if you want individual feedback on speaking, I am here to help. Okay. So thank you so much, all of you. Thank you.
Thank you, doctor.
Thank you, sir.
Thank you.